Hi, welcome to my page. Today I want us to talk about women that have had previous cesarean section scars. Now, my name is Dr. Bridget. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. If you have not subscribed, please do subscribe, share this video. In the tropics, this video is actually for most people in the tropics and some other women. There are two types of delivery. When a woman is pregnant, at 36 weeks, we'll plan for how she will deliver. What is the mode of delivery? Especially if she's a first-time woman, someone that is having pregnancy for the first time. If the woman is having her first pregnancy, we'll call it prima gravida. We'll consider a lot of things at that 36 weeks. 36 weeks means really she enters her 9 months. So if a woman is 36 weeks, we plan for her delivery. We'll use what is the weight of her baby to plan this delivery. Most times we allow them for vaginal delivery. Vaginal delivery wants them to have normal childbirth. We don't want cesarean section. But let's assume that this baby is big, more than 4 kg. And you see that even if that baby comes out, her shoulder may get stuck or that she may have complications during delivery. We'll try as much as possible to encourage her for abdominal delivery. So there are two methods of delivery. One is vaginal delivery, one is cesarean section. Cesarean section is the abdominal delivery. Now, if a woman is having vaginal delivery, she could just have normal vaginal delivery, or she could have assisted vaginal delivery. Assisted vaginal delivery with the use of vacuum or forceps. Now, if the baby is breech, we can have assisted vaginal breech delivery. Now, for any reason the woman is going to have abdominal delivery, that's cesarean section. That is one previous scar. We'll call it after delivery that the woman now has one previous cesarean section scar. When she's pregnant and comes back again, we consider what caused her to have her previous cesarean section. What made her have that previous cesarean section? Where was it done? Who did it? These are the things we put in consideration. Who did that cesarean section? How many days did she spend in the hospital? Now we'll go on to say, what's the reason for her having that cesarean section? Is this something that can reoccur, or something that is not recurrent? We'll put these things in consideration before we choose her next delivery, whether she's having vaginal delivery or another cesarean section. If she's having vaginal delivery, we'll call it trial of labor after cesarean section, or we'll call it vaginal birth after cesarean section. That is for someone that's had one previous cesarean section. In some centers, if she has had one previous cesarean section, she's allowed to go on another vaginal delivery. But if there's another indication for her to have another cesarean section, it means she's going to have another second cesarean section. That is 2 previous cesarean section. That is where the cocoa lies now. For someone that has had 2 previous cesarean section in the tropics, remember that each time that uterus is cut, the integrity of the scar reduces. If the scar was thick before, it will reduce and will no more be thick. Then it continues to reduce as much as you are cutting on and bringing out the baby from it. So someone that has had 2 previous cesarean section in the tropics, we encourage them that after you have 2 previous cesarean section, you go for another cesarean section. Nobody tries to put oxytocin. Nobody tries to put misoprostol for you to deliver. Because of the integrity of the scar that is now less, the person may rupture inside labor. And when she ruptures, the baby will die. The baby may die, especially if he's not close to the hospital, and the woman may lose her life. You see why? Now, in advanced country, they may allow second cesarean section, someone that has had 2 cesarean sections, to attempt vaginal delivery. The gadgets for monitoring are there. They don't have many whacks, and people that have had these surgeries have good health-seeking behavior. In the tropics, the health-seeking behavior is so poor. So we advise you, if you have had 2 previous cesarean section, let it enter your head. Please, you are going for another cesarean section. If you have had 3 cesarean section, you are going for another cesarean section. We encourage you to have cesarean section. If you have had many cesarean section, that does not mean you cannot bet all your children through cesarean section. What we consider is we cancel you on the things that may happen, because the more you have had cesarean section, the more the integrity of the scar is reduced. So that's the length of that scar reduces. So we advise you, number 1, someone that's had 2 previous cesarean section, if you have had 2 cesarean section, your next delivery is going to be through cesarean section. Don't go and try. Don't go and put drug. Don't allow them to put drip. Please, for the sake of your life and the sake of your unborn babies, and for the ones that you left at home, even if you have delivered before and you have 2 cesarean section, we advise you for another repeat cesarean section. So just go with this. 1 previous cesarean section can attempt vaginal delivery. 2 previous cesarean section in this part of the world will go for another repeat cesarean section. That is the message I have come to deliver today. Please share this video. A lot of women are doing the unthinkable. Please share this video. Subscribe to my page. My name is Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. I discuss everything about women's health, children's health, and sometimes men's health. See you next time.